Hello patients, good afternoon. I'm here to explain you today about the decompression and fusion in cervical spine, because whenever there is a query and we reply to that, most of the patients are confused. What does a decompression and fusion mean? So this is the cervical spine structure. As you can see, it's a model actually. If you want to see in detail, then this is the vertebral artery. The red one, these yellow ones are the nerve roots which are coming out at every level. The transparent structure here is the disc, and the white thing is the bone. This is the part of the skull. So skull is resting above the cervical spine. Now, if we talk about, first we talk about decompression in the cervical spine. So there are two basic approaches when you operate upon cervical spine. One is the anterior approach and one is a posterior approach. That is, you go from the back of the neck or you go from the front of the neck. Depends on the experience of the surgeon, depends on the kind of the pathology and need of the patient. So if you ask about me, then I'm much more comfortable doing the cervical spine surgeries, whether it's a one level or multiple level from the front, because the damage to the tissues when you dissect to go anteriorly is much less. And when you reach here, now imagine we started here and we have reached here, so there would be a retractor and there would be a very microscopic incision. The incision would be hardly an inch or less, and through this we are reaching this area. So when we talk about a single level degeneration, so the disc is degenerated, the facial joints are arthritic, there is a pressure on the cord or on the nerves, so we remove this. If it's a healthy spine, a young spine, then this disc has to be replaced by another artificial disc. If that is not the case and we are going to do fusion, then after the complete decompression, which involves the removal of the bony spurs or the bony overgrowths and the damaged disc, then we remove it and we replace it with a structure which is known as a disc-like structure known as a cage. And these cages again made of various kind of material, whether it is PEEK or metal or titanium or something else, and we have to replace it so that the height of the disc is maintained, so that the arthritis at the facial joint is less, so that neck pain is treated. At the same time, the nerve pain is treated, because the nerve pressure which is there because the disc also is removed during the decompression. So that is what is the fusion in one level. We can do this at multiple levels also, depending on the need, depending on the disease process. Now, there are two ways to fuse it. One is, as I told you, putting the cage filled with bone. So fusion will occur between a bone and a bone. It will not happen between a metal and a bone. So we will fill it with bone. So the bone will be responsible for the fusion between the two vertebral bodies or the adjacent vertebral bodies. Now, if we think that the spine is unstable and the cage with bone itself is not enough, then we put a small plate here which is fixed with tiny screws so that it does not come out. That is another way. So I personally have stopped using plates in degenerative spine for a long time now. Even for a 3 level, we would just do a cage, because there are various kinds of cages available which have spikes and they do not move out, they are not mobile very much, and they are very safe to be done. We have done multiple surgeries and we have post-operative follow-ups for the last 3 years, and they have been really successful. And the psychological element of the plate, or sometimes when the plate is causing dysphagia, those kind of things are not happening in these patients. I'll take another model and explain you that if this is the model, then you have to go posteriorly, and then this part of the spine is removed, which is known as laminectomy. Laminectomy is removal of this part of the bone. It can be 1, 2, 3 or multiple levels. The more the levels of laminectomy that you do, it becomes more unstable, as a result of which you have to fix it, which I'll come later. So one is laminectomy, second is laminoplasty, which we do very commonly in cervical spine. What do? We make burr holes in this area, we make it thin, and on the other side we make another thin, and then we lift it up. We lift it up so that the canal is the area for which the cord passes through, So when you lift from here, and you make a more room, the room for this, the cord which is going inside is increased. When this is increased, and it is fixed on the sides, it is known as laminoplasty. So you have done the the changes in the lamina, where the room for the cord or the nerve has increased in size, or it can be in the form of fenestration or laminotomy. So small holes in the bone, here, if you have to do a posterior discectomy or some tumor removal through a small opening. So these are the kinds of things. Now if we have to do a fixation, anteriorly I have already explained you that the cage has to be applied or multiple cages have to be applied, it has to be replaced with the plates, or you just do a disc replacement, which is the simplest, one of the simplest way to do single level cervical spine surgery in young ones. Now if posterior, so this is the sample which you can see here, these are the 2 screws already fitted in. So if you have to fix this spine, these are the lateral mass screw which goes on the lateral mass of the every level, and then they can be connected with the rod, as a result of which this can be fixed. Now for the fusion, you can do either you can use a burr and make it rough so that the new bone formation is there, or you can put bone pieces on the side of these screws and the construct of the rod. That is how the fusion is done posteriorly. Anteriorly I have told you. Thank you very much. I hope I have been able to explain you grossly about the fixation, decompression, fixation and fusion of the cervical spine, anterior and posterior. That is the basic knowledge. If we have to do some more complex surgeries regarding tumors or more difficult diseases, then we do have procedures which are much more complex, but this basic knowledge is good enough for you patients so that you have a fair idea what do we mean when we talk about decompression and fusion. Thank you.